Hello. Hi, 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 hi. Hi, you guys. What's going on? I saw that Moneyboy Trade decided to already come through and make his trolling behaviors a part of the conversation today. Welcome to Life Discussions with Dr. Jefferson. If you guys are viewing me for the first time, I want to welcome you guys, but I also want to encourage you guys to, subscribe, hit the notification bell so you can definitely be notified when new content is about to be unveiled and all that great stuff. Thank you guys for those of you who came through and have sat with me through a couple of shows today. This is our late night regular thing, and I wanted to have this conversation because I have a ton of questions coming in about this particular topic. But yes, this is a channel that is primarily around accountability conversations that affect the Black and the Brown community, the melanated folks out there. And I do my best to hold everybody accountable individually and collectively, as they do have an effect on us in the way that we function, move, and grow, if we do that at all. So, um, with that being said, today's conversation, we've previewed some of the topics, some of the areas that we're going to cover or whatever, but I do want to invite you guys and encourage you guys, if you are a person out here and feel like, you know what? That lady has no idea what my experience is. Why? Because I don't know what your experience is, right? And you want to share your experience on the show today, or if you want some advisement, because I am a sex therapist, I'm a psychotherapist here in the Atlanta area. I do provide sex therapy services and coaching services to clients pretty much everywhere in the United States, but also in Finland, Norway, Sweden, Africa, and pretty much all of the areas in Africa. But a large part of my coverage in Africa is in Nigeria and West Africa as well, and Cameroon. But I want to talk to you guys today about some common issues around the sexual experience. There is a tremendous amount of misinformation, and you guys know I'm always here for accountability, right? So I gotta admit, that guy Kevin Samuels, you just keep sending topics my way. I appreciate you. Continue to do that. But somebody got in contact with me and sent me a video that Kevin Samuels did and said, you know what? This is what Kevin Samuels said about why it is that women can never level up, because they don't understand the sexuality of a man, the needs of a man. But men have been doing a pretty good job at getting to know women for years. And so this conversation is going to be pretty comprehensive. We're going to talk about some of the very important aspects that affects sexual intimacy and other forms of intimacy, and how you guys can scathe off some of the issues, more importantly, that come along with age and the onset of sexual dysfunction. Okay, so I'm going to give you guys some jewels. You guys are going to get this stuff for free. Okay, right? And I'm going to clarify some things for those of you who are out here who are huge Kevin Samuels fans. Let me go ahead and do this adjustment really quickly. But yes, some of you that follow him religiously and feel like, okay, this guy is a god, or godfather is what he calls himself, right? Hold on. How do you even spell his name? But so for those of you who feel like he's a god, he's been giving you some jewels and dropping some very reliable information and all that good stuff. I'm going to debunk some of that crap because, it is what it is. But I'm going to give you guys some free information. That's the great thing. You don't have to pay for it, right? Unless you want more. Unless you realize that this right here has led to you needing a lot more. Okay? So let's talk about sex, right? What is sex for you? That's my question. So if you are currently sexually active, if you are not a virgin and are currently engaged in sexual behaviors either once every 2 weeks or once every 1 week or once every day or once every couple of hours or whatever, I want you to type a 1 in the chat right now. If you've never engaged in sex at all, and this is more informational for you, type a 2 in the chat. If you have been sexually active for the vast majority of your life, but now you're currently not seeing anyone and you've been pretty much abstinent for the last 2 weeks, I want you to type that wonderful 3 in the chat. Okay? So we're going to jump right into this. Sex is considered to be a very high form of intimacy between two people or more people, right? And oftentimes when people think about sex, they think about a penis and a vagina meet ways, or a mouth and a penis meet ways, or a mouth and a vagina, or a combination of penises, or a combination of vaginas and mouths, whatever. Sex can be a lot of things. Sex can definitely be an invigorating restoration means of collecting energy and exchanging energy, and also getting very close to the person that you're with. The highest form of interest in intimacy, though, to be honest with you, is kissing. It's an interesting thing about locking lips with people, but also kissing in general, which is why people find it pleasurable for people to deliver oral sex to them, because the mouth has a lot to do with connecting, you know? So that's that part. Sex is a healthy expression. It helps to increase your energy. It helps to increase your endorphins. It helps to increase those wonderful feel good chemicals in your brain, your oxytocin, your dopamine levels, serotonin levels increase, like life in abundance as a result of sex. So if you're not having your best sex after you guys sit through this segment with me tonight, which is going to be long winded, don't get me wrong, but after tonight, you're going to go forth with greatness and you're going to be able to overachieve. All right. So, a sexologist or a sex therapist. And hi, Rodney. I am a sex therapist, and there are lots of sex therapists out there. Typically, a sex therapist is a person who specializes in psychotherapy and other therapeutic modalities around sexual dysfunction. So we help people to get to a greater level of functioning, or an initiation of functioning, right? Because some people come to sex therapists before they even start engaging in sex, because they want to make sure that when they do move into that part of their lives, they're prepared or they know what to expect. Okay. A sexologist is a person who studies the science behind what makes sexual connecting between people effective. Okay. So oftentimes these two do go hand in hand, but you do have some psychotherapists that are sex therapists out here who don't typically study the sciences. They could care less about the numbers. And at the end of the day, just come on and give me the outcome. Okay. Tell me what works. You guys are going to have to excuse the noise. Of course, it's Independence Day. But a lot of people are like, tell me what works. And that's all I need to know. Let me just tell these people what they need to know to have the best sex of their life. And that's enough for them. And that's all right. So personally with me, you guys know I come from the MD side of things. So of course, infectious disease pathology leads to understanding sexual wellness, right? Because a lot of people end up with sexually transmitted diseases. And we're going to talk about some of the things that the misconceptions that people have around odors and sex. We're going to talk about all that stuff today. All of it. All right. But so at the end of the day, you guys will walk away with everything that you need to know about what makes good sex good, right? And what makes mediocre sex mediocre. And like I said, if you feel like you want to share your experiences, just let us know that you want to log in and then click the link and come on in and you can share your experiences. Or if you need some advice on specific issues that you and your partner are going through, then definitely feel free to chime in. The other disclaimer that I want to make is this: sex is oftentimes an act that not only men and women engage in, but also men and women and women, and sometimes in groups, women, men, and things like that. So some of the conversation is going to be around the entire constructs of sex. I had a person in one of the polyamorous groups that a man asked me the question. I think it was yesterday. He asked me the question. He was like, so what does a solo poly look like? No, the other girl asked what a solo poly looks like. And I explained it to him. And he was like, wait, whoa. exclusivity. Thought that poly meant that we're out here and everybody's having sex with everybody. No. Oftentimes that is a misconceptualization, but polyamorous relationships have several different dynamics and structures, and there are rules and regulations that guide and shape healthy behaviors there too. So boundaries are something that you definitely need to be familiar with, and healthy boundaries allow for people to be as sexually expressive as they can, without feeling like they need to be restricted or inhibited, right? So, let's talk about it. That leads us to GGG. Who knows about it? So, if you've ever been to a sex therapist before and you've started from the bottom up, that means you came in with no particular problem and you were like, okay, well, I think I want to know more about, you know, my sexual performance. I want to know about my partner. I want to know how I can, better satisfy my partner. What are some of the best practices, right? And the reality is, people are curious every day. Okay. However, I know, right? They are getting it in out there. But however, it's not often that people come in just because they have some issues, okay? And so when we talk about GGG in sex therapy, it means good, giving, and gain, okay? Good means that you have to be good in bed, right? Now, if you want a healthy sexual relationship, you want to make sure that your body parts are prepared to engage in sex in a meaningful way. So, if I say meaningful and we're trying to engage in sex with partners, right? That means that your body needs to be in good condition. Okay. So you need to be good at or fluid at the thing that you want to do for your partner. So if you are a woman, that means your vagina is well kept and it's up to par and it's ready to engage in the sexual activity with the guy. Oftentimes, sexual health and wellness that women engage in on a day to day is not up to par. The same thing happens for men because nobody told somebody at some point in their life that you do have to engage in healthy sexual practices, which is why I feel like as a sex positive person, I encourage sexual health and wellness classes in middle school, because I feel like this is where these kids, oftentimes, if they're not already engaged in sex, they start to explore with it because of the phase of development they're in. And it's really important that we give them what they need in order for them to keep themselves calibrated for when they do go out into the world. And sex is a huge component of a committed relationship. And now that person is engaged in sex and they want to better their chances of being good in bed. Okay. Now, I'm going to talk later about some of the things that you can do in your daily routine to keep yourself good. Hygiene, A1. Vagina, A1. Penis, yeah. Even if you're a guy out there that's like, well, you know what? Is my penis large enough? We're going to talk about the numbers. We're going to talk about the realities. We're going to talk about some of the things that, some of the myths that people say, well, if a guy has large hands or a large foot or he's tall, that means his dick is big. We're going to talk about all those things. Okay. So let's get to the truth of the matter in being good in bed. Okay. If you're good in bed, that means that your partner, both of those or many of those, however many you have, are satisfied with your sexual performance. That means you've identified and you have connected with what their body is telling you that they are enjoying, okay? And we can look for signs based off of the way the body responds. I think it's pretty easy for the most part to recognize when a male is turned off. It's pretty easy. However, that can sometimes get misconveyed. All right. Producer, we're going to save that question until the end. It's a good question, though. But so if you're good in bed, that means that you're connecting with them. That means you're leveling with them. That means you understand that they have a particular need, and you meet that need in a particular way. Okay. So by giving, I mean that you need to be willing to give what it is that that person wants you to give when it comes to sex. That means the time, the energy required, and the deeds as well required for their sexual pleasure. So it's not necessarily about yours, it's about them. And this is what we say is the three main causes of healthy sexual behavior with your partners. Okay. So if you know that your body's energy isn't sufficient for them, that means you need to be looking for alternatives. And you do have to be extremely crafty sometimes when you're looking for alternatives. I say in the last G is game, because you have to be game for everything when you're looking for those alternatives. But you do have to have healthy boundaries, okay? So you said those are cultural practices in countries where natives still practice their norms and there's no need to visit a so-called sex therapist. Definite. Well, no, I won't say that. So in some countries, right, if we talked about like in Africa, right, where we're considered to be sexologists or sexual doulas and things like that, when they're coming to visit you is typically in preparation for marriage. The females come so that they can make sure that they're preparing their vaginas to move into the relationship and be acceptable for their husband. Males are coming for reasons of sexual dysfunction. And this is very much, it's always been a cultural practice for them. And typically women will go off for a matter of weeks so that they can prepare themselves for what marriage entails and they can prepare their body physically. Now I'm not gonna say I agree with everything that goes on during that time, because I have some things that I'm like, no. But that's if that's your culture, that's what you believe in, I'm 100% here for it. I am going to do what I can on my part to encourage body positivity and healthy sexual um, energy around what is to come. So the other one is, let's see if I can move this all the way down. It makes it easier for him. Okay. Sex positivity and body positivity matter. So, the matter of being sex positive means that you, as a person, believe that it's very, very important for kids, young adults, and even older adults to engage in sexual creativity, and sometimes watch porn if that's necessary in moderation. And you accept the fact that sex is a natural component to living, right? So you're not grossed out about the topic of sex. I think that most people when they see me, they're like, I think it's very odd that I just walked in, had a conversation about, what I've been doing sexually or the thoughts I've been experiencing sexually and things like that. And you just didn't make any faces or anything like that. The reality is, I'm a psychotherapist. I hear everything. That's the reality. And, this isn't my first walk in the park, right? So I deal with sexual issues every single day. I deal with sexual stories every single day. And for me, it's really important that I help people to maintain a positive outlook on both body image and sex. So oftentimes you guys may hear Kevin Samuels talk about the fact that a woman's body is pretty objectified, and he has a particular ideal that he's sitting out there and he's setting on the table saying, hey, this is what men want. The first thing that I'm going to say is that no particular man or woman can speak for all men and women universally when we talk about the one thing that they want. When we talk about sex, however, and we talk about the studies that we've conducted and what we found out about people who are sex positive and people that were restricted in their sexual practices, the things that we found out about best sex practices have been as a result of collected information from pretty much everywhere. Okay. Um, Happy Independence Day to you, official urban therapist. So, South America and Africa girls are nature. Yes. They are taught to be wives before they become teenagers, because oftentimes what you got to understand is in most countries outside of America, education is done when kids are around, what is that, 13, 14. You guys continue for a length of time here, but comprehensive high school ends at 8th grade. So formal education is very different. But so most women are preparing to be married in their teens. Age of maturation is different everywhere. Different cultures have different ideals around not only sex, but relationships, love, maturation, humanity, the life cycle development, all of that. But so, the common issues that I see in society, like I said, is those men who take the ideals that, you know what, women can't satisfy men because women know nothing about men and their experience. And then men can't satisfy women because men don't know what to do. The reality is you will never know what to do with a person sexually if they don't disclose that information. And because people are so different in their sexual desires, it really takes a tremendous amount of observation for you to operate from a place of understanding when you're intimate with them sexually. Okay. So I want to talk about some of the common male sexual issues. So for the guys who are watching in the chat right now, I want you guys to list some of the things that you've heard become an issue and when those things become an issue. I know those of you who have checked this out from the beginning, you guys saw a preview of all of the topics that we're going to talk about today. But whether those topics are there or not, and you've already seen them, I want you to type some of the issues that you have learned are common amongst men and what age group typically do they become affected and things like that. So while you guys are typing, I'm going to start talking about some of them. So some of the main things that I see men ask questions about around their sexual health over the course of my combined experience seeing patients are going to be an imbalance when it comes to what their ejaculate material looks like. So trying to identify what is different about my ejaculate material, like what's normal and what's not normal about that. Also smells when it comes to the odors that come with ejaculate material. And so I'm going to address those concerns. So and of course, erectile dysfunction or erectile disorder or what they call impotence is definitely the most common issue in men across the board. Between age 50, typically is where you see men first start to approach having that issue. 50 to 55. And then you have some guys who are just onsetting having that issue in their 60s. Okay. And also the frequency of erections. So a lot of people don't know that when men are sleeping overnight, men have about 25, somewhere between 25 and 30 erections a night. That's the interesting thing. A lot of men don't know this because, of course, they're asleep. They're asleep. They don't know. It's like, that's not happening to me. It's no way it's happening. Yep, it is. Because it's not because you're thinking about sex. It's not because you maybe getting ready for sex, but your body has a cycle that it goes through in order for it to prepare yourself for healthy sexual engagement. Okay. You said a lot of men don't like telling the woman that she doesn't know what she's doing in bed because they don't want to hurt her feelings, so they end up cheating. Somewhat. Some guys do. But for the vast majority of guys, if you're going to cheat, you're going to cheat. Okay. Sex is sometimes a reason that people will cheat, but it's very rare that that will be the primary thing there. especially in committed relationships, because there is so much more there. But also, I think that what happens is I see a large amount of men that are not quite sure about themselves in a relationship and what it means when their sexual performance starts to die down, and they want to test out their sexual performance with other people because they're like, you know what, maybe this ain't a me problem, maybe it's the person that I'm with, right? And they're not getting me there. The reality is a male's body will continue to function in the capacity that it's meant to function when it comes to sex, for as long as it needs to. Okay. And as long as you remain healthy. Okay. But so let's get back to that part, right? So with men, with some of these common issues, I will talk to what's normal. A healthy ejaculate material is typically going to be thick and kind of clumpy, and it's supposed to be white consistency. It's not supposed to be clear and thin, liquidy consistency. So if you notice that you're having an abundance of that, what that's indicative of is that you have a low sperm count. And some people associate the low sperm count with low testosterone level, but that's not always the case. Oftentimes, it just has to do with your diet and your exercise regimen. So it's really important that you guys are on top of your diet and exercise, because this is truly what indicates how healthy your sperm count is, and how healthy the consistency of your sperm is, and also the odor. I talked about the odor component because I had a lot of guys. I've had so many guys ask me, Dr. J, like, am I having sex with nasty women? Like you tested me 6 times and I got nothing. You keep saying all my tests are negative, but there is something wrong. So in that capacity, if there is a fishy odor associated with your semen, it doesn't mean that you're having sex with nasty women, okay? It doesn't mean that these women that you've had sex with smell like fish. It just means that you don't have the right balance in your diet right now. And so I always talk to men about things that they can do to help themselves balance out what causes the foul odor. And not only will these things help to balance out the foul odor, but it's also really, really good for healthy sexual functioning over across the board. Okay. And I'm going to give you guys the key to curing ED in a healthy way, but don't go out here trying to do the most. Okay. Don't go out here. I'm going to make sure I make that statement first. Do not go out here trying to do the most and say, you know what? Dang, this doctor gave me the key and I looked it up and I saw it's consistent, blah, blah, blah. I'm going to give you guys that key later on. So you guys will have the cure to erectile dysfunction. And actually, it's a lot stronger. So that's why I'm going to say exercise caution as you use that, because it is stronger than Viagra. And it's our most recent science, actually. So before I get to answering the question about the issue with the sperm, Mr. Good Guy, I'm going to ask you this. Have you muted the show first? Are we good to go? All right, so I'm gonna, okay, so obviously he has not muted the show. Just make sure you guys have muted the show so we can add you if you want to come on and share your experiences, okay? But so let's go ahead and let's get to this, okay? So hydration has a huge amount to do with the foul odor associated with your semen. Okay. Semen should not have a foul odor. Every male has their own body odor. It's very unique to you. Like every female has her own body odor. It's very unique to her. But your semen should never smell fishy. And it's not It's not that, you're eating a whole bunch of fish, because the thing is, with women it's a different thing. Okay. With men, oftentimes it has a lot to do with smoking tobacco, not getting enough exercise, not maintaining a healthy weight, not maintaining a healthy gauge on their stress. And the most important thing is sleep hygiene. Because remember, I just talked to you guys about the fact that males experience, 35 or so erections throughout one night. One rest period is 4 to 6 hours of uninterrupted sleep. That's when these erections are taking place. And that's one of the reasons why your veins need to practice operating in a certain way. And the male body is going to make sure it takes care of itself when you decide to let it rest. So you do have to let yourself get proper sleep. That doesn't happen at nighttime for every male, because some men work overnight and then they sleep during the day. But just make sure that you are getting that 4 to 6 hours of uninterrupted sleep, which equates typically to 6 to 8 hours of full sleep. Okay. Um, the other component is what you eat. Okay. So you do have to eat foods that are very high in protein, high in B vitamins. So like your lean meat, fish, poultry, eggs, avocado, peanut butter, your milk and dairy products, the leafy greens. I always say eat lots of spinach. Okay. Said it's not good to take Viagra. I had a friend who had a heart attack taking it. I agree. You have to take Viagra when it is safe to do so. That's one of the main reasons many men do not get what in the world? Okay, yeah, no. Interesting. Okay, so sorry, I got distracted with the chat thingy. But so anyway, um if you if you're taking care of yourself and you're eating the foods that you need to be eating, you won't have to worry about the fishy odor associated with your semen. You have to make sure that you're hydrating yourself, getting lots of water, making sure that you get those foods that are high in protein and your B vitamin rich foods. Also, that's really important. Okay, so let's go to. I don't know if I should give you guys. So the ED, age of concern. I already made it a note of that. Typically men start to recognize an inconsistency in their erection between the ages of 50 and 55, or the ages of 60 and 65. So there are a couple of reasons for that. Sexual health and wellness develops a little bit different than the other areas of development for people in the brain. So, for men in particular, depending on how sexually active they have been and how early they started, this can look different. So, men who were engaged in sex before they entered their, early adulthood, they typically go through erectile disorder when they're older, right? So, about 60 to 65 for the first time. And that typically looks like um not as strong of a penis. So when I just talked to you guys about those particular things, the foods that you needed to be eating, those are things that will make your penis stronger. Okay, so there is a difference in having a larger penis and having a strong penis. So a strong erection means that it's extremely stiff, inflexible whatsoever, and it's definitely there to do the job. So one of the things that I'm just gonna put it out there that Kale says, um, one of the things that I recognize him saying is that it's heavy, right? So a hard and heavy penis is typically ready to do the job, but it's considered to be stronger than just weighed down and heavy. Okay. So it's not going to be as hard if it's not ready to really go through and do the job. But that's one of the number one things you start to see when you're noticing the signs, the first signs of erectile dysfunction or disorder. Um, so for those of you who are waiting for this cure to erectile disorder, just know you're going to be waiting a minute now. So you have to be extremely honest when it comes to engaging in sex with your partner. I noticed that one of the comments said that the guys are afraid to mention, that the woman isn't good in bed and things like that because they don't want to hurt her feelings. But the reality is you must be honest, because if you're not honest, there is absolutely no way that you're going to satisfy a woman. There's just no way. And it goes both ways. One of the main issues when it comes to females and sex is that many females have never experienced an orgasm. I've had clients that were in their 80s and they had never experienced an orgasm. Common female sexual issues are not infertility. Okay. A woman can be infertile and still have a high level of libido and 100% desire sex. And the length of sex, we're going to talk about what's a healthy length of sex as well as it relates to the male and female. The reality is women have grown so accustomed to not being the person who is satisfied during the sexual encounter that instead of them engaging in the conversation safely with their male counterpart, they will go ahead and they'll say, you know what? I'm going to pull out the toy. I'm going to handle this myself while he goes to take his shower. Or you know what, babe? I got to go pee. And in the bathroom, somewhere tucked away, is her solution for the day. So I want this to be a conversation that helps you guys grow closer to your intimate partner, so you don't have to do all those things, that masking and lying to each other that leads to instability in relationships. A healthy sex life equals a healthy life in general. Sex is good for you, okay? So when we talk about a healthy length of time to engage in sex, this one is oftentimes a point of high controversy because men are like, this is helping me stay up, you guys. Excuse me. So men are like, well, women are unrealistic in their expectation of us during sex. I have had clients come to me where men have a problem with coming at all because they feel nothing. So that's not true, guys. It's not true. Some people just have a problem with premature ejaculation. You got to call a thing a thing. And if that's a thing for you, call it what it is. Sex lasts anywhere from 33 seconds. It's a thing, believe it or not. It's a whole thing, yeah. From 33 seconds to about 45 minutes. That's a combined number from the interactions of men and women, okay? The average amount of time that it takes for a man to ejaculate is anywhere from the 33 seconds to about 7 minutes of vaginal penetration. So we're not talking about the entire act of sex. And oftentimes I'll hear both men and women have a very difficult time gauging how long they're engaged in sex. And with my clients, I will definitely help them along the way with getting a healthy gauge on sex without making it awkward for them. But before I go into that, let me go ahead and answer this question real quick, because I don't need y'all out there thinking that booking a sex therapy session equates to you fucking me, because it ain't happening. So a sex therapist does not engage in sex with her clients or his clients. However, there is an act of surrogate partnering that we do to help people who are single or whose partners are not present for whatever particular interaction we're teaching to help them along the way. Surrogate partnerships do not equate to sex either. I want to make sure I make that clear. So you said, so by what you have just said, that would mean most women can't be satisfied by a man. I guess that's why Eve cheated on Adam. No. And I mentioned earlier that a lack of satisfaction in sex is typically not in any way a means for people to cheat, believe it or not. So you said 45 minutes is way too long. Well, we're going to talk about that. So I talked to you guys at the very beginning of this video, and I said that this video is meant for all people engaging in sexual practices, whether it's male to male, male to female, female to female, female to male, right? Or group even. It applies across the board. And when I'm talking about a sexual session, I want to make sure I make that clear as well. A sexual session is from the beginning of the initiation of penetrative sex to the end where the penis is no longer hard or the woman is no longer aroused for that moment. So hopefully you guys got all of those components, okay? All of them. Now, a female is capable of coming about 2 to 5 times during one session of sex. You have some people, that's about 2 minutes long and from penetrative sex. And that's very satisfactory for woman to male sex for some people. And that's where we're going to get into conversation about penis size. And also I'll give you guys some natural means to enlarge your penis if you're interested in that as well. But like I said, we're going to talk about those Ayurvedic cures, those remedies, those natural means. We're going to talk about those to the end. And like I just said, I don't need you out here trying these things on your own. I'm just giving you these resources to discuss them with your healthcare provider to see if it's right for you. You said some men can go on for hours. So I talked about that too, right? Did I not say there are some guys that don't come at all? Yeah. So that's also a sexual dysfunction. That's not normal. Actually, the average amount of time that a penis can remain erect without causing significant issues in the venous system. So that's your vein pumping blood through the body, from the heart to the body, to the blood system and things like that into your brain. The maximum amount of time for a safe erection is about 45 minutes. And that's hard. That's pretty dangerous for long-term health of the male. Okay. But to get back to the discussion, okay. The size of the penis typically does matter when it comes to how long it takes for woman to male to woman sex and satisfaction for a woman. Happy 4th of July. How are you, William? So I think that people get it misconstrued. So when I say penetrative sex, that means uninterrupted. And I know that that's a means that many men use to prevent themselves from coming. They take it out, put it back in. That's common. And actually, that's one of the start-stop techniques that we teach, even in sex therapy, when men have a problem with premature ejaculation. It does work for some men. It can be quite effective for about 72% of men. And I think that's a lot, to be honest with you. So it can be effective. Also, males do need to practice Kegel exercises. If you're struggling with erectile dysfunction, I'm telling you, it works. It works like wonders. Sensate focus is another thing that if you guys are interested in sex therapy and you and your wife or your girlfriend or whatever, or just you yourself, are thinking about going to see a sex therapist, sexologist, or seeing someone for that same issue, definitely talk about that, and they can walk you through and they can give you some exercises, and that it helps a lot. I mean, I've seen it improve sexual satisfaction in relationships with people well into their 80s. So you said that's one of the reasons why some men have more than one wife. Why do you think that is? Oh, because they can't ejaculate. So the lack of ability to ejaculate or to have an orgasm for a man has nothing to do with his natural um sexual appetite. It has to do with incompatibility. So we talked about keeping themselves sexually well. That's a very huge component. You know, there are lots of men that just simply do not feel anything. And there are a combination of reasons. Some men have a very low amount of sexual sensory glands on their penises, and that's typically underneath the tip of your penis where the head is. There is a slit, and then typically you'll feel some raised abrasions or raised bumps in that area. They're all centralized. Those are actually sensory glands that go all the way back to your brain, to cause an increase in functionality and response. So me and my boyfriend go for hours, but then with my baby mother we only last for like half an hour. Yeah. Um and that's what I'm saying. So when I say uninterrupted, I definitely mean uninterrupted. So not switching positions, because that's definitely something that helps to elongate the experience. Not taking it out and in, but from the moment that it's inserted to the moment that the person ejaculates. So compatibility has a lot to do with sexual wellness. And if you have a man that feels like one woman can't satisfy him, I always say, explore the options. That's a component that I talked about with the GGG. You have to be game for what works. You can't just be good at in bed, because that's the component. So in order for you to have a healthy sex life, we're going to go back to the 3 Gs. You got to be good in bed. Take these notes, okay? You have to be given the energy necessary for your partner to be calibrated sexually and satisfied sexually. So even if you guys are new to having sex, sexual exploration is very, very important. You have to allow yourself to explore everything that could increase the efficiency of your sex with another person. You have to be very much calibrated with yourself, right? In order for you to go into this space and then not only be good, but also know what's needed for you, for the other person, to give you sexually. And the last G is game. You have to be game for whatever that self-exploration leads to you finding out about yourself, and whatever that self-exploration of your partner led to them finding out about themselves. And so I say within reason, because when you come into a sexual situation, you pretty much know what your boundaries are. And when you are in an intimate partner relationship with you guys, where you guys are bound to one another and you're committed to one another, there are certain conversations you need to talk about before you move into making yourself accountable to that component when it comes to committing. Okay. That's just what it is. Okay. So, heart health is very important. You guys have to make sure that your adrenal health is up to par. You have to make sure that you have the right amount of protein in your body, especially men. These are our sexual wellness tips for you guys, okay? You have to make sure that you're eating avocados, apples, also bananas are really good, nuts. These are aphrodisiacs that are natural, but also these are things that increase the sexual wellness in men, but also increase the propensity for a man to last longer in sex as well. You have to make sure that you keep yourself hydrated. Make sure that your diet is balanced and colorful. The pelvic floor exercises are very important to this process. Sleep hygiene is the most important to this process. And of course, avoid tobacco, but also other smoking. Because smoking cuts down your propensity to be able to provide good, healthy sexual experiences for your partner in the long term. So we talked about that strong penis, right? So there is a difference between a functional penis and a strong penis. A functional penis can maybe get the job done, but a strong penis is going to definitely get the job done every single time. There are no questions about it. Okay. Don't hurt nobody out there. Okay. Go get them, Tiger, but don't overindulge. Okay. But um so that's that one. If you want to last longer in bed so that and you're not having a problem currently, some men can go up to a solid hour, ladies. Okay. And ladies, the vast majority of women who are uninhibited that are watching this video definitely know what I'm talking about when I'm talking about the length of time that a man goes in bed as it associates with a woman actually being satisfied, because the woman's satisfaction is much more harder to achieve than the male's. A woman getting an orgasm is so uncommon. And ladies, I'm going to talk about what an orgasm is as opposed to you coming as well. So you said I had to explore my options. I realized I like men and women. I have a girlfriend and a boyfriend on the side. The best of both worlds. Definitely. And sometimes that's a necessity. Oftentimes, oftentimes both men and women are very inhibited, not sex positive, about their sexuality. And as a result, their sex life, their personal life, their interpersonal, behaviors and relationships suffer. So, men ask the question, how many rounds does it take to satisfy a woman? I guess I'll go ahead and get to that. So the reality is, women are more difficult to satisfy in bed because it takes more than just the physical connection for a woman. For a woman, you have to have the physical connection, proper positioning, but also you have to have consistency in certain thrusts, okay? But the most important thing is that the vast majority of women out here also need a spiritual connection with you. They are sharing energy with you. You are passing off energy to them, and they are passing off energy to you. But the vast majority of women in society have some deep-seated trauma. And as a result of that deep-seated trauma, they need to be really connected with the guy to even get to a place to where they are vulnerable enough to unveil those layers that allow them to climax into an orgasm or even climax into just coming. Okay. So I talked about the fact that a woman can come somewhere between about 5 times, right, max, during one sexual penetration session. Okay. Her coming does not equate to an orgasm. It just equates to moisture. So that's the equivalent of maybe the physical sensation that happens prior to you getting to an orgasm. Very, very seldom do we have men who don't achieve an orgasm at the same time that they come. Now, when we talked about earlier the semen and what it looks like, what healthy semen looks like versus problematic semen or questionable semen outside of, confirmed diagnosis of a sexually transmitted infection or whatever. One of the things that I didn't mention is that many men have never experienced a sexual session where they didn't have an orgasm. And when they do, they start to feel like something is wrong with them. Okay. So an orgasm is the orgasmic experience, the climactic experience is the same for both males and females. Okay. So if we look at it in its entirety, an orgasm is a feeling of high euphoric experience. So, and this is what is going to lead us to identifying what the issue is with men when they feel like they can't go again, right? So once you feel a high euphoric feeling, your dopamine, serotonin, oxytocin, norepinephrine, all of your feel-good chemicals increase. Oxytocin is a chemical that is typically increased in the brain as a direct result of sex all the time, okay? However, I have to advise you guys that the reality is it's a one of a kind feeling. So it's almost like if you had imagined that you were free falling, okay, having jumped off of a plane or jumped off of a cliff, and then you just slowly started to feel prickly components not only on the surface of your skin but also inside of your body. For a woman, intense orgasms go through your uterus first, and then typically to your pelvic floor, and then into your vagina. For a man, it goes through their prostate first, then to the pelvic floor, and then into their entire body, not just the penis, but entire body, because the penis is typically stimulating that orgasm, that orgasmic climactic experience for them, because when they ejaculate, it has to pass through the compressed space of their prostate as it's moving from the scrotum into the penis. So it goes through the prostate and the anus, which is also why men that are engaged in anal sex also can, ejaculate. Okay. So if you're a woman and you've not ever experienced an orgasm, or you're wondering why it is you can't, experience an orgasm or whatever, take your time, try and find the right energy, try and find the right guy for you to tether yourself to so you can, achieve just that. Okay. So, how small is too small of a penis? A penis is considered to be too small when it's a micro penis. I think it's between 2 inches and 3.33 inches is what we have deemed to be not efficient in order for most women to achieve an orgasm. Now that does change when men have a pretty thick penis. Okay. So it is what it is. But if a man has a really nice girth, he still has the propensity to create a satisfying situation for a woman, but it's highly unlikely that she'll get to a climax. Okay. So to go back and address the question about men who are not able to get hard again after the first round or after they have ejaculated, right? I talked to you guys about the increase in dopamine levels, right? And oxytocin. So dopamine and testosterone levels decrease drastically when a man ejaculates, right? And so prolactin is a hormone that's produced by your pituitary glands, increases during this time. If we have a situation where you have your feel good chemicals that have decreased as a result of you ejaculating, and prolactin is increasing, you're not going to be able to achieve an erection. You're just not. You're just not. Um, I always say, as men, you have to do your due diligence, know where you're approaching, age, and know where you're not taking care of yourself and things like that. Now, if you increase the amount of avocados, those very high grain and wheats and stuff in your system, if you have ginkgo biloba, if you have L-citrulline, and L-citrulline, by the way, guys, is what I was going to tell you guys. It's a replacement that is very much potent, and it's a replacement for Viagra. About 40 milliliters or so, 45 milliliters is, it works like a charm. Tribulus is also a really good plant that bears fruit, that's really healthy for the male erection and staying up past your first ejaculate experience. So I think that you guys should do what's necessary for you to remain tethered and healthy as males, and then you don't have issues with a woman leaving, just in case she's the type of woman that will leave you as a result of you not being able to get up, right? So my question for you guys is, would you leave your partner if the sex was subpar? So not necessarily terrible, but not the best. not the best sex. So let's go to size matters. Many women say that size matters. Like I said, and if you're gonna have a penis that's below about 3 inches or so, size might play a huge role. So when we talk about penis enlargement oils, I talked to you guys about the girth being something that could help you get over the hump. GRF oil is pretty healthy, and it helps with growth. Okay. So that's something for you guys to talk to your doctors about. But I don't know what to say. If you have a small penis, then you probably shouldn't be using it. The other thing that is a huge point of contention, I have a lot of guys asking me, is it not normal for me to, ejaculate every day? Actually, it's quite healthy. So there is no science that backs the fact that it's not good for a man to ejaculate every day. However, once a day is very different from people who have an issue with masturbating, or what we call chronic masturbation and porn addiction and stuff like that. So those are two different things. Okay. So if you're going to try and stay healthy, remember that you're trying to relieve yourself based off of what your sexual urges are. Like I said, your penis is going to get hard overnight about 35 times or so. So do you think that every time your penis is hard that you're supposed to be engaging in sex, or that you want sex? No. That's not necessarily a point of contention, but also oftentimes men will notice they have a hard penis, and as a result, because they have associated their penis being erect with the need for sex, that's the natural thing that you guys think, like, oh, well, I'm ready to have sex. And half of the time, your penis isn't even going to come to the table fully to the party, because that's not what it's hard for. So there are a lot of different reasons that your penis finds itself erect that do not end in you ejaculating. Okay? Okay? So that's that one tidbit. But if you do have a healthy connection with your sexual partner, for as long as you can, as many times as you can, connect. Have as much sex as you feel like is appropriate for you. Just make sure you're getting the right type of exercise so that your cardiac muscles are ready to respond in the event that you're doing sex too often and you're about to bust your blood vessels. Okay. A healthy time to engage in sex, like I talked about before, is somewhere in the medium. So the average woman is content at about anywhere between 5 and 10 minutes. So if with a man, a woman is not going to want to continue the one entry penetration session with a man for 45 minutes. First of all, it's pretty much impossible. That's just not the way the male anatomy works. You're definitely going to ejaculate unless you play with it several times by taking it out, confusing it, making it not think that you're in there and doing something, engaging in sex. But you have to be honest with yourself and be honest with your partners about your limitations. Also, do some things, variate the acts that are happening over the course of sex. So maybe engage in oral sex before you start. Physical touch, kissing is the most intimate encounter. Have penetrative sex and then stop, and then go back to oral sex, or decide to shift and get yourself clean and engage in anal sex, or whatever you want to do. But we don't encourage people to have anal sex and then vaginal sex, because if you go from one to the other without protection or without a condom on, you can definitely cause some issues with bacterial transfer. Okay. And nobody wants to get a bacterial infection just because they're trying to have some pretty interesting sexual experiences, right? So, but oral sex is fairly safe. The other question that I get a lot from people is it healthy to ingest semen? Now, when I talk about this one, I know some people are going to be like, oh my God, like I never knew that. But I'm going to need you guys to sit down and pay attention for this part of the conversation, because some people feel like they just know everything there is to know about sex, and they've been doing sex for a particular way for so long that they really don't think anything can go wrong. Okay. So let me know when you guys are ready, and then I'm going to go ahead and give you the lowdown. Okay. No questions, no other conversations going on. All right, so here's the answer. Here's the reality. Although many people engage in swallowing calm or calm shots and things like that, some people are allergic to sperm, believe it or not. And when those people are allergic to sperm, they run the risk of very serious consequences when they are swallowing sperm. So it's not necessarily healthy for everybody. But for some people, they don't have any issues whatsoever, and it's fairly safe. And to be honest with you, the vast majority of people is fairly safe. But HPD is an issue, okay? And you have to be aware if you're a person that responds negatively to swallowing semen, if you start having an itchy throat, if you start to feel like you're going to be sick, if you start to have like a stomach ache and start to break out and things like that, just know that, okay, this may be something that doesn't work for me. But for the vast majority of people, for the most part, they don't have any side effects or whatever. So I think have I covered all of the things? Or did I not give them the natural Viagra? I didn't give the natural Viagra. So let's do that now. For men out there who are struggling with erectile disorder and have a problem with either keeping your erection hard enough for you to continue to function, or even gaining an erection to begin with, I talked to you guys about L-citrulline. And L-citrulline is the number one ingredient, the leading ingredient, the most active ingredient found in Viagra. Okay, it's fairly safe and fairly natural. However, it is definitely known, because it's an amino acid, it's known to increase the flow of blood to the heart. Okay, and that's why some men have a heart attack. However, we find that the amino acids found in watermelon is a thing. Look at that. It's a thing. Yeah. But the amino acids found in watermelon are richer in amino acids, and therefore they dilate the freaking blood vessels, just like Viagra, but more effectively. That's crazy. Crazy. So go out there and get yourself some watermelon. Sam's Club has them on sale for $4.98. Okay. But I'm not playing. Serious. Relaxing and dilating your blood vessels, just like freaking Viagra. Okay. Just like it. So go out there, get it in. If you guys need help with, I don't know, booking a session or something like that, you can reach me, doclqj at familiarbonds.org, or you can send me an email, doclqj@gmail.com, and I'll equally respond to you on either one. Also, you can find me anywhere doclqj speaks, or Facebook /doclqj. So that's my show for this evening. Thank you guys so much for sitting through this hour and 12-minute presentation of information. Hopefully, I've given you guys something that resonated with you, and something that can definitely help to get your sex life off the floor. I know that I didn't speak along about some of the things that are women's issues, simply because the women's issues are typically due to a lack of communication and conveying what their needs are to their man. So My suggestion is going to be make it safe for women to convey those messages, and don't sex shame them. You know, sometimes your penis is subpar. You need to just sit with it and increase, improve, whatever you need to do, guy. Like, or, women start exploring other options. Figure out what it is that your body needs for you to be satisfied. Explore some. Don't be ashamed. Don't feel some type of way. Get in the mirror, look at the parts of your body, label the ones that you don't like. And if you don't like them, let's figure out why you don't like them. Okay. And then I want you to start embracing those parts of your body. Touch them, make them feel welcome, wanted, needed. Share with your partner that you want them to embrace those parts of your body as well. And you'd be surprised how many of your body parts that you see as negative or you don't really desire that your partner is really gravitated to. Okay. So also for vaginal odor, for those of you who are struggling with vaginal odor and you feel like you need to use a douche for that, I want you guys to stay away from that. That's my number one advisement. The next thing I'm going to advise you to do is incorporate a healthier lifestyle. So make sure that your pH is remaining balanced. Make sure you're drinking vitamin waters and waters that are high in alkaline to keep your pH balanced, and also use feminine soaps. So no harsh soaps and, fragrances and stuff down there. You don't need all that. Don't need it. You don't need it. Mm-mm. Also, if you want to change up what your ejaculate material tastes like as a female, you want to make sure that you're eating the right things. So that means you're not like the guy that needs to eat fish. Okay. You need to stay more along the lines of eating pineapples and stay away from fish. You literally are what you eat, women. Down there, your flora is based on your diet. So it is what it is. So that's all I got. Hopefully I gave you guys something that resonated. Take it, go forth, be great, and have great sex. Later days.
Whole life can't put me in a box. I redefine any definition you got. I am the tiger, I'm making steps to the top. The flames I whip it up, you just gotta hand me the rock. Take a seat, you cannot stand it. All I know, the flow harder than a Scotch bunny. Don't try studying me, you cannot manage. This ain't what you want, bitch, I'm a fucking phenomenon. This ain't what you want, bitch, I'm a fucking phenomenon.